Hey, I'm Avi Weisfogel, founder of Dental Sleep Masters. I'm here to talk to you about the event coming up March 4th through the 6th in Las Vegas at the Wynn Encore Hotel. This is not your ordinary sleep event. If you have been to a sleep apnea course before for dentists and you haven't really gotten to treat much patients, you're about to find out why. I started in sleep in 1998. I took a course with Dr. Keith Thornton, who was the inventor of the tap, one of the most widely used oral appliances in the country. I learned the science of sleep and I learned how to make a tap. I came out and I opened my practice, and week one I saw a patient. Amazing stuff. I didn't see another patient for 6 months, and I really wanted to see patients. I found this intriguing. So what did I do? What would you have done? I took another course, and then another course, and another course, and they were all exactly the same. They taught me the science, but I learned a different appliance. So if the course was sponsored by Cornflakes, you would have learned why the Cornflakes appliances was the best appliance in the country. But none of them taught me how to see patients, and that's what I wanted to learn, how to see patients. After about 10 years of banging my head against the wall, I finally decided I was going to do something about it. I had a successful general dentistry practice, but I really wanted to see sleep. Now, my wife was my office manager. I had a great associate, and I said to both of them, I'm going to leave the practice in your hands. I want to go figure out the world of sleep. So I practiced on Mondays only. It was a long Monday, but Mondays only. I walked away from my practice and started interviewing all the people in the world of sleep, the sleep doctors, the sleep labs, the DME companies who are handing out CPAP, the hospitals, Medicare, the insurance companies, anybody who was involved in the world of sleep. My goal was to find out why, as a dentist, no matter what I did, I couldn't see more than a couple patients a month. When I got out into the world of sleep, what I found was astounding. The world of sleep was broken. And I'm not talking about from a dental perspective, I'm talking about the entire process. When I found all this out, it honestly was a miracle that I even saw one patient, let alone 2 or 3 or 4. Doctors just don't screen for sleep. A typical doctor who graduated more than 10 years ago got no hours of sleep education. If you graduated in the last 10 years, you got a whole 2 hours of sleep education. I want to show you that because these doctors aren't screening, there are not enough patients for the sleep doctor to send you. So if you think the sleep doctor is your problem in the world of sleep, that he's not sending you enough patients, you're right, he's not sending you enough patients, but if he sent you every patient he could, he wouldn't have enough business to survive himself, which would obviously make it impossible for him to exist. And that's exactly what I found from my biggest referral source. She said to me, Avi, if I send you all the patients that are mild and moderate and I didn't put them on CPAP, my practice would cease to exist. I have the same problem you do, I just don't have enough patients. So I started thinking about it, and instead of thinking how I was going to get more patients for me, I said, what if I could get you more patients? Would you then start sending me more patients? She said, if you start sending me patients, I promise you that all those patients you send to me, I will take the mild and moderates and send them to you. I said, all right, sounds easy enough. Now, I had a little bit of an advantage. I had a dad who was a cardiologist who, like every other cardiologist, did not send patients to sleep doctors. So I talked to him and I said, Dad, I think we can do something better. I think we can make a difference in the world of sleep if we just change the way we started screening. That was the beginning of the Dental Sleep Masters programs. We start going to other doctors in the world of sleep. We don't rely on the sleep physicians. We go to internists, we go to cardiologists, ENTs, pain management doctors, and we show them how to set up a sleep run practice the Dental Sleep Masters way. When you do this, you get to see all the mild to moderate patients that come out of their office. So let's do a little quick math. A typical internal medicine doctor sees 20 patients a day. 30% of those have sleep apnea. That's 6 patients every single day. 60% of those or more will be a candidate for an oral appliance. So we're talking somewhere between 3 to 4 patients every day from one small internal medicine practice will be sending patients to your practice. That's 15 to 20 patients every single week from one small practice. So imagine a small internal medicine practice. They see 20 patients a day. 30% of those patients are candidates for sleep apnea. That's 6 patients a day. 60% or more of those patients are candidate for an oral appliance. So somewhere between 3 to 4 patients a day from one small practice will become an oral appliance candidate. That's 15 to 20 patients every single week, or 60 to 80 every month from one small practice. Now, does everybody get to see 50 or 60 patients a month? No. As a matter of fact, there may be a handful of dentists in the country that get to do that. But I can tell you that there's a lot of people in the Dental Sleep Masters doing just that. We don't just stop at 20 to 50 patients. We're looking for guys who want to see 100 patients or more, each of which will get paid $3,000 or more. We're going to show you some amazing proprietary Dental Sleep Master stuff that you will only hear March 4th through the 6th in Las Vegas. That's at the Wynn Encore Hotel. Go to DSM Reveal to register for that. DSM Reveal, you can register for the course March 4th through the 6th at the Wynn Encore Hotel in Las Vegas. It will be the biggest course in dental sleep history. You don't want to miss it. Thank you.